Hello, beautiful people. It's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehab, here to talk to you about how to prepare for an amputation. So, you've been told that you're going to need an amputation of your lower extremity, and this is devastating news for many. But know that you can still live a fulfilling and functional life after an amputation. And I'm going to talk to you about some things to prepare for the amputation so your chances of success are much higher than if you did not. So, there are 150K plus amputations on average a year, and the most common cause for this is peripheral vascular disease. And the greatest risk factors for peripheral vascular disease include high blood pressure, smoking, and diabetes. So, just know that if you are not dealing with any of these issues, you want to try to maintain a healthy lifestyle so you don't get any of these diseases, because amputation is a risk factor if these diseases go uncontrolled and become an issue in your cardiovascular health. Now, 3 things that you want to do to prepare for an amputation. One is prehab. Prehab is just a short term for pre-rehabilitation. So you actually want to do a rehabilitation program prior to surgery, because this is going to increase your chances of having success in function and getting back to where you were prior to surgery, if not even better, and increase your chances for a prosthesis if you qualify for one. Now, the prehab program is basically going to focus on endurance, strengthening, and learning how to mobilize with one leg. So I'm talking about lower extremity amputations here. So you're going to have to learn how to mobilize with one leg until you are fully healed and cleared to get a prosthesis if you qualify. And if your functional ability prior to surgery does not cause you to meet the criteria for a prosthesis, you might not qualify for one. So I don't want to mislead you by thinking everybody gets a prosthesis. And the type of prosthesis that you can get also depends on your level of function. And that is something to be determined usually by a physical medicine rehabilitation doctor. So get a PM&R doc on your team early in the process so that you can start your training program so that you'll have success. So you're going to learn how to do transfers on one leg, so that's getting from a chair to a bed or from sitting to standing. Learn how to use an assistive device like a rolling walker or a wheelchair, which you will use as you're healing. You're also going to need pain control. So this is something you want to talk to your surgeon about before, just so you know what to expect. Some surgeons use more invasive forms of pain control like epidurals or nerve blocks, and this will deaden the signal of pain for a few days after surgery, and then you'll switch to oral medications, usually opioids or neuromodulating medications like gabapentin, and these you will eventually wean off of in a few weeks after surgery. And finally, psychological support. Psychological support is very important pre-amputation, because this is a major surgery and it's going to change your life drastically. And you can still live a good quality, high functioning life, but it's important to have the counseling prior to, so you can address all of your questions, your concerns, your goals, your expectations, and talk about what to expect, like phantom limb pain. Phantom limb pain is pain experienced in the amputated limb where it used to be. So if you had a below knee amputation and your brain is telling you that your foot hurts and your foot is no longer there, that's what we call phantom limb pain. And there are various strategies to help manage phantom limb pain, which is usually temporary. And I shared that in a different video called How to Care for Your Residual Limb After Amputation, so you can look at that. And that's pretty much it for preparing for the amputation, okay? And just know that you have to wait for the swelling to go down and the limb to heal before you can get a prosthesis. So please don't rush the process. A lot of patients after amputation day after surgery, they're like, when can I get a prosthesis? And it's like, slow your roll. We cannot do that yet. So usually it's about 6 to 12 weeks on average. Okay. So just know that. All right. Hope this was helpful, and I wish you the best. If you are getting an amputation, you can still live a great life. Do not let this make you feel otherwise. Okay. But you have to put in the work. So if you are a person who's severely debilitated and would love to partner with a physician who is committed to seeing you thrive, no matter your circumstances, I invite you to join me by booking an appointment at freedomwellnessphysiatry.com and subscribe to our email list so that you can get tips and support along your journey with more detail and information on things that you can do to live your best life. Thank you and have a great day. See you next time.